Good afternoon, everyone. Alisa Haushalter, Director of the Shelby County Health Department, and on behalf of Mayor Strickland and Mayor Harris, I want to welcome you to the Joint Task Force update. Today I'm going to give some data updates, but I also want to talk about some of the activities that are occurring relative to our overall response, and then I'll turn it over to Dr. Randolph, who will talk and give more updates about our enforcement activities, and then we'll open it up to questions. So as of this morning, we have 53,058 cases. That's an increase of 695 in a 24-hour period. We've experienced 722 deaths, and the average number of reported deaths is increasing in more recent weeks. So we are averaging about 5 to 6 new reported deaths per day. Currently, we have 3,595 active cases in the community. Those are individuals who have been diagnosed with COVID that still are infectious and pose a risk to others. Our positivity rate is at 12.9% over the past week. That's well above that 10% average that we would prefer to be below. And so it's an important number to look at. And our reproductive rate is over 1 at the current time. Also, we have over 8,000 individuals who are in quarantine at the current time because they've been exposed to somebody who was actively infectious. I'm going to give a few updates on the gating criteria and then that overview of the response per se. We continue to have a significant amount of testing capacity. In addition to our already existing capacity, the City of Memphis is hosting regular testing each weekend through the holiday. So we're really encouraging people to know their status. Please go get tested and know your status. And this is specifically important for individuals who are less than 40. Everyone's welcome to be tested, but we need more information on the population that's younger than 40 because they're more impacted currently by the infection. Our hospitals continue to have strain on their capacity. They're doing everything that they can to be able to meet the needs of the patients that they serve. But we do anticipate this continuing to be a challenge because of the current surge, which is significantly worse than the surge we experienced earlier in the pandemic. Within public health, we're doing everything that we can to continue to do contact tracing. That's not just the health department alone. Many employers, school systems, and others are assisting with one, notification of people who are positive, but also placing them in isolation and assisting to identify their contacts. Continue to do a great deal of enforcement, which Dr. Randolph will detail, and we're also prepping for the vaccine. So some of the key things that I wanted to note, we have said for some time now that we are really at the fall surge, that we were foreshadowing a very difficult fall and early winter. But in addition to this being the peak of the pandemic, not just in Shelby County, but nationwide, this is actually the peak of our response locally. So I think it's important for all of our citizens to know what's happening, one through the Joint Task Force, but also many other partners who assist as ad hoc members along the way. In regards to hospital capacity, there's been significant effort put forward to look at what can be done collectively to assure adequate staffing in the hospitals. There's been work with the healthcare systems as well as with the local academic institutions to look at how we can utilize students or individuals who are near the end of their education to provide additional support, not just for hospitals, but for the bedside, but also for vaccine administration and vaccine administration to the community. So that's moving forward. There will be a tabletop exercise in the upcoming week that helps identify what those stressors on the healthcare system will be and what the possible solutions are so that we can move forward with those.